Hello, I'm Beth. Welcome to my channel, Mindful Yoga with Yogi Beth C. That's me. Today's practice is going to be a rehab type yoga practice, a short practice to address discomfort on one side of the body. I call this yoga SOS, or Soothe One Side. You'll have the option of doing the second side after you complete the first side, but we're really only going to do one side today. Now, this is going to be a combination of self-massage and stretch. For the massage, you will need a simple tool, a little rubber ball. This is actually just a little playground ball. It's called High Bounce Pinky Ball. I love these because they're dense yet a little bit squishy, and they're easy to find in most big box stores or online. Now I also have, this is a more specific therapy ball. This one happens to be a little harder. You can choose the density of your ball. Tennis balls work great, and so do dog's balls. So if you can steal the ball away from your dog, you can try that too. You may also want to have a block, and then definitely have either a blanket or a bolster nearby for one of the stretches we'll do. I'll show you both versions. We're going to start lying on the ground with your ball and have your block nearby. So come to your back. And let me just show you, as you lie down, I want to show you the two main areas that we're going to stretch on the back. So the first area, actually I'll come a little upright, is basically around the area of your jean pocket. Probably you're wearing yoga clothes, but you get that area, somewhere around the glutes, the hips. And then the second area is going to be more the lower ribs. Now in ball work, these are not exact areas. You get to move around and find out what works best for you. So lie on your back with knees bent, feet on the ground. And then take your ball to that first area, which is somewhere around your pocket. Lower than your waistband, lower than the edge of your pelvis. And you want to move it around and let your weight settle over it until you start to feel a bit of pressure into an area that maybe has some discomfort. Now, if you're not really feeling anything, you can either slowly move the ball to another spot. I'm rolling so that the ball rolls a little bit more to the outer edge of my hip to see if that's more of a spot. And I'm feeling stuff. I started on the side that I have more discomfort. Another option is you can take the same leg that you have the ball underneath and cross the leg over into a figure four. Now, as you do this, what you're doing is you're drawing a little bit more weight or gravity down onto the ball. In ball work, we move really slowly, trying to find sort of a Goldilocks spot where it's not too hard, not an ouchy kind of sensation, but we want some sensation, so not too soft. Somewhere in between those two. And if you find a spot, you might see I'm moving really slightly. You can stay in that spot. And again, you're allowing weight to sink down. You can roll your body a little bit more toward that side to get more pressure, more gravity into the ball. You might also do some gentle movement. So here I'm swaying my hips back and forth a little bit. Always going super slowly. And if I find a spot that's more sticky, I might hold there. I can move my upper leg knee around to get a little grinding action. So when you're using the ball, you can rock, you can grind or twist. The whole time taking movements that are slow enough that you have a chance to check in and see how it's affecting your body. Now, if this is too much pressure, it's an ouchy stretch the whole time, you can do this ball work against the wall. So the ball would go behind you and you would push into the wall. That helps you control the pressure more because you don't have gravity weighing down on you. So maybe you find a slightly different spot. I'm moving my ball a little higher and a little more to the outside of the hip. we're going through muscle fibers, and so we're really trying to get more hydration into the muscle fibers. You might feel some edges of bone there. We're not lingering on bone edges. We're really focusing on more of the connective tissues. Maybe one more spot here where you can stay for a few breaths. You're breathing in and out through the nose, slow and even, can help with a relaxation effect during this process. And then if your leg was up, take it down, come off the ball. Take a moment to feel how that feels. Now, you probably will notice some different from side to side. If the other side is begging you for some attention, you can go through, we're going to do basically 3 different things on the one side, those 3 things on the one side, and then just skip back and go to the other side, and I'll include some chapters below. All right, the next spot is going to be that other spot I mentioned that's more along the upper ribs, or the lower ribs actually. Now here, this is where when you put the ball under, just place it to start. Because our backs have a natural curve, you might have trouble feeling any pressure on the ball. So it might not feel like much at all. Now, of course, you can have, if you have a bigger ball, that's going to feel like more pressure. If it's enough pressure, stay right here. Or you can take your block and use the block to prop up the hips. And depending on how you're positioned, that might help you get a little bit more pressure on the ball, a little bit more gravity. I don't know if you can actually see the ball here because it's kind of underneath my back. And take the block out. I think I preferred it without the block. So I'm moving around underneath the last rib into an area that is getting close to the QL muscle, which is really deep, so we can't quite get all the way to it. The lats muscles, a lot of muscles on the side body can get really tight. You can also lift the hips a little bit up, a little bit down. So that'll give you a different kind of motion on the balls. All right, last ball position. I'm going to sit up for a moment. I'll slide the ball up. And it's going to go on the inside of my shoulder blade this time, so higher up than where it was. Let me see if I can find that spot. Sometimes the hardest thing is getting into the spot. Ooh, I can feel that already. So I'm just going to stay here and chill for a moment. Now, if your pain is on the side body, you might feel something here because our upper bodies tend to be tight. It might not have as much of a direct impact on the side, and yet everything is connected. So it's nice to do a little bit of work for the upper back after we've done the lower and the mid. Now notice this is also giving me a little bit of a back bend, so it's helping me get width across my front body, across my chest. Maybe you can feel your breath moving into your upper body. And we'll take 3 full in and out breaths here. Breathing in and out through the nose. And then once more, take the ball away. And we'll pause just for a moment here. feeling that whole side. You might feel as if that side is a little bit more weighted on the ground, maybe more spread out on the ground, more grounded. And you can go back right here and repeat that on the other side, or you can join me in a seated position. We're going to do a stretch for that side that we just rolled out. This is where you'll want your blanket or your bolster, and you might also want your block. I'll put that up there. So if you're using the blanket, I'll use the blanket today. You want a pretty thick blanket roll. I'm actually going to roll mine and then double mine up. You can also adjust this depending on your body. We're going to be lying on our sides. The side of your body is the non-tight or non-sticky side is going to go over the body, and then the blanket is going to come right under the ribs. So somewhere under the ribs, your bottom arm is going to reach out and your shoulder is going to tip toward the ground. Now your head can rest all the way against the ground. You can take your arm overhead to get more of a stretch from your fingers and even reach out your leg, fingers to your toes, but legs can be in any position. You can also use the block as a little pillow or head support. And of course you can have an actual pillow here. So we're getting some stretch here, but not as much or not as intense a stretch. This is more of a passive stretch, a release. Of course, you can make this more intense by stacking up more blankets, a bigger bolster under your ribs, so you have more of an arch to your side body. And as I said, you can also reach the arm and the leg away. This is making a little bit more of an active stretch. You're pulling the muscles along the side body. I'm going to stay here for a few more breaths, keeping this pretty chill. Breathe in and out through the nose. As you're in a held stretch like this, you might also want to start incorporating a longer exhale. That encourages the relaxation response of the body. So that might be something like breathing in to the count of 3 and breathing out to the count of 6. Using your own breath pattern as a guide, no need to follow me. Last 2 breaths. Can you exhale through your nose a little bit more slowly, a little bit more expansively, expanding the breath with depth and also with width. Let's take one more. All right. Use your arms to slowly help yourself up. And then we'll finish with one symmetrical stretch. So we worked a lot on the side body. Let's give our body a chance to regroup a little bit in center. Take your blanket, you can unfold it a little bit so it's not as high. We're going to do a heart melting pose. This is also called puppy pose. So this variation, we're going to have our hips in the air. Your hips are going to stay over your knees. Your elbows are going to come down to your blanket, maybe your forearms, whatever is comfortable. You might find you need to walk your knees back a little bit. And I'm going to take my elbows so that my elbows stay down and my hands come up and melt my torso. That's why it's called heart melting. Resting my forehead on the blanket as my heart tips toward the mat. Hands can come behind the head if you'd like.
few more breaths, feeling that symmetrical stretch in your body. And then slowly walking your knees back in, bringing your hands down.
Right, what did you think? Can you feel that difference more on one side of the body now? I would love to hear your comments. Now remember, if you want to repeat, just go back to the point where we first started, do it all on the second side and finish with that same stretch. That might feel really great in your body today. Let me know what you think. Try some of my other videos as well, and I hope you'll join me again soon. Have a good rest of your day.